sorry for being late. Whoops, we had a technical glitch. Yasmin, announce the topic.
Hi everyone. So I just wanted to introduce myself first. Yasmin Haddad, a family dietitian here at my Pedia Clinic, and Yasmin, Dr. Yasmin Kottait, also a pediatric dentist at my Pedia Clinic.
Yasmin Power. Yasmin Power Unite.
Big time. So today's topic is very special dear to our hearts.
Yes, we love it.
And it's because also April, as you know, is the month to raise awareness on the autism and the spectrum, Autism Spectrum Disorder, correct? ASD.
Yes.
Because it requires a multidisciplinary team.
Yeah.
Once diagnosis has been made. And part of the team are, dietitian, pediatric dietitian, also dentist that is specialized.
Shout out Chai.
Yes, specialized for
seeing kids with autism.
Exactly.
Right? They need a team around them. They need love.
They need occupational
and they
health.
need a good team.
They need also parental support.
Yes.
They need speech therapy.
Yeah.
Feeding therapist at times is needed.
Yes, absolutely.
So really, when I say multidisciplinary, it is, and it has shown to help. And here at my Pedia Clinic, we make sure we take care and we refer to each other when needed.
So we have lots of awesome patients that we've helped this way.
Exactly, and they are so special.
Autism is so beautiful.
So really
and
smart.
Understanding a kid on the spectrum is so beautiful, and it's so important to understand who do you need help. Whose help do you need, to help your child.
Exactly.
So let's celebrate Autism Awareness Month, but of course, getting your questions. Please ask us questions. Hey Namita,
yes,
we're here for
Arabic
you.
Or in English,
you
or
have
in
a
French
nutritionist
even.
And a dentist, and we want to talk to you about you and your kids, and of course your questions. Okay. So Yasmin, we wanted to ask ourselves our questions both in dentistry and pediatric nutrition. That's what I love about you, Yasmin. You're a specialist in pediatric nutrition. So tell us, what is a commonly asked question to you as someone that sees kids on the spectrum?
Well, I get many. I see different cases of different age groups actually, and I also get different cases that some have been diagnosed and they are seeing seeking therapies they need, and some not yet. So as a nutritionist, I'm always here to guide and make sure everything, because as we said, it's multidisciplinary.
Yeah.
So going back to the frequently asked questions, well, the number one question I get asked is there a specific diet for kids with autism?
That's a very good question. They keep asking.
Yes, so my answer is kids on the spectrum, they usually are very sensitive to taste, smell, texture, الملمس. So all these
they have a lot of sensitivity.
Exactly, a lot, even with sound. I'm sure this Dr. Yasmin, she can elaborate on that. When it comes to nutrition, taste وطبعا texture smell play a big role, because what happens then, they are very selective with their food, so they only stick to specific foods they feel they are familiar with, they like, they're comfortable with, and they refuse to touch or even look at or even taste any other foods. So this may lead on the long run, with issues such as increased picky eating is number one. Yes, this is what I mean. So being selective can lead to picky eating, and can even lead to a child being underweight, or malnutrition can happen, especially if you're omitting certain food groups. And this is why a pediatrician also is needed. So we have Dr. Rita and Dr. Medhat to rule out any food sensitivities, because they are at high risk of having digestive issues. Sometimes it's an underlying factor that may increase the picky eating, such as it could be gluten sensitivity, it could be even constipation, it could be reflux. So because they do not, children in general do not express themselves very well. They don't know how always, especially if they are on the spectrum, correct?
Sure.
And this is why to rule out any underlying physiological factor is important.
Yes.
And at times also a psychologist is needed to rule out any like excessive phobia or anxiety related to certain food. So this said, the diet should be, we have to try to introduce more variety. There are strategies, there are ways. Everyone is different, every child is different, every parent is different. So trying not to, most important, do not quit. And another factor is like, a question that I get asked a lot is the gluten, what, there is a comment?
No, I'm sitting here not doing anything.
Oh,
right. Can
yeah,
hey,
course,
besties.
You can,
Yasmin is
give
just
your
talking, and I'm
input.
just like,
Hey.
la. Okay, so, let's have a conversation. Let's, please ask us your question. Mustafa, I know you want to ask us a question. You're our bestie. So ask us questions.
So I'll ask you a question.
Yes, ask me a question.
So the question is, if a child with autism comes,
Yes.
see, like a mother, she would ask maybe, how do I have my child come visit the dentist without the anxieties and the fears? So how do you deal with that?
Look, so I love when you introduced autism as kids do not like taste. They're sensitive to sensory, to taste, to auditory, to a lot of things.
Exactly.
And you know what? Dentistry is not different, and food is not different. So they would not want to touch your food. They do not know. They only like what's comfortable. And because the dentist is also unknown and it's like a surprise, the most kids on the spectrum won't do well with a dentist because that's totally new. So now I love your question. What happened to the lab? So I love your question. What's important is understanding the psychology behind autism, asking the expert how they can be of help. In our clinic, what we do, we give them a social story. Do you know what social stories are?
No, what is...
We can totally have a social story for you,
What's that?
A social story. The kid on the autism spectrum likes surprises or does not like surprises.
No.
Does not like
I'm
surprises.
assuming they don't.
They don't like surprises.
They don't.
We like surprises, but only if they're nice, right? So surprises are not the best for a child on the autism spectrum. So a social story tells the child exactly who they will see, how they look like, what they're gonna do, and what is the expected behavior from their part.
Very interesting. Oh, I think I've come across
my social story.
I love it.
Yes,
it's so
nice.
Elaborate. It's so nice. But do you hand it over before they come to the appointment or when they are here?
The thing is, some of the patients don't tell us beforehand their kid on the spectrum. I get afraid. Okay, thank you. I'm afraid.
Here.
Thank you.
Thank you, Dr. Mustafa.
Thank you. So actually, it's so nice. So actually, we can send it ahead of time, but what happens is sometimes when they're here, then we show them the look of the room, the dentist, how does the dentist look like, what is expected of them, like open your mouth, you're gonna do this. So maybe for you, you're gonna show them your picture, your room. They have to see your room. They have to understand what your room looks like. And of course, then, your, what's it called? The BMI thing.
Yes.
What's it called?
The weight and height.
I don't like to get on.
No, the body composition
yes,
analyzer.
body composition. What's it called?
Body composition analyzer. But there's brands. There are different brands.
Okay. So the body composition analyzer. Maybe you can show it. And then they have to get on top, and then they do this.
I actually make it interesting to them, and they get very excited. What do I tell them? I'm like, oh, this is the like a machine. Like that takes you to space or Mars, so we can always pretend, and like a spaceship. And so they get on it and it does a sound, and then you arrive to Mars, and then so it's like a whole journey. And I think for me the struggle lies with food. So how do we get them, like you said, how they fear being at the dentist, and you have ways to do that. So their fear is certain foods. This doesn't look nice. I don't want it. And they're scared, and they don't want to eat it. They don't want to get near it.
What is it called? Getting scared of food?
Neophobia.
Neophobia. That's amazing.
Yes.
And it's real. What
It
do
is.
parents do about it? They
So
need help.
it requires a lot of patience, time, strategies,
Understanding
and
psychology.
exactly, and not to force feeding or getting upset at a child with autism for not eating something will not help. I always suggest setting a schedule will help because they like routine. So having a routine in place, so there's a time for breakfast, it's time for lunch, and it gets them ready for the next meal so they're not too full and they're not too hungry.
Yes,
Okay,
that's
so
good.
setting time for meals
Yes.
and choosing their snacks wisely and giving them the option, but you as the parent or the caregiver set the options. So this
Yeah.
or this. Do you want a banana or do you want an apple? And they choose.
Both are fruits.
And we can even create like a fun environment and eat in front of them to show them, oh,
Nice.
this is fun, this is
Yeah.
crunchy, this is that. Get them excited about it. And avoid screens during mealtime because the
Yeah.
screens will only let them, not be mindful of what they're eating and how much they're eating.
You know, for autism, for kids with autism, it's super important to tell the parent not to use food as a positive reinforcement.
Yes, big
Because
time, big
when
time.
they come to the dentist and then the positive reinforcement is Nutella, believe it or not, and I do have lots of kids like that. Now what are you gonna do? I need to look at their teeth and they need the positive reinforcement.
I like that you mentioned that because this rewarding with food, whether it's a vegetable, fruit, or a sweet, is not recommended. Or punishing with food also. So
right.
food should not be used as a reward or a
Yes.
punishment. It's instead
Food
you
should be
use-
neutral.
Yes, exactly. So if you want to reward them, you can use like a stars, stickers,
Or an activity.
activities, things like fun.
Or iPad time.
So things that are non-food, basically.
Yes, yes.
And what else do you see? So if the child with comes, and what is so common with children with autism? The most common dental issues.
Thank you for asking me this question. It's a great question. So the thing is, hi Rosanna. So the thing is, kids on the spectrum, they do not trust food. They do not trust anything that goes around their mouth, right? That's what happens with you and me, right? And we share this. So what happens is they don't eat good quality food. So then they get decay. And because they're picky, they get decay because they only snack. And then because their food is not nutritious, then their gums are not as strong. And because they don't want to brush, then they get more decay. And when they don't want to brush, then they're not going to accept me to brush, and then they're not going to be trying any new food because it hurts
It's a
to chew the
vicious
food.
cycle.
Exactly, and it goes on and on and on and on. And mashallah, between us, we've helped so many kids. I fixed their teeth and she fixed their diet. And mashallah, until now, like years, and still the child once. You remember the child that's only on milk, right? You remember that
Yes,
boy?
I remember.
Only on
I was
milk.
about to mention.
Yeah,
Yes.
So to give you a little bit of perspective, we're still talking about kids on the spectrum and kids with autism. And this boy, he's a big boy, and all he drank was milk.
And one of the reasons is he has motor skill, like chewing difficulties,
Yes, he
right?
couldn't chew.
So, but
And
this
he has
doesn't
decay.
mean you only can get milk.
I love you,
There
Rachel.
are ways to introduce soft food that is
Exactly.
nutritious and
Yes.
balanced. And as Dr. Yasmin said, he was living on just
Milk.
although he was I think around 9 years of age, 8 or 9.
Yes,
maybe.
8 years. Now he's 9.5. He's almost 10. But now tell us how. Of course, I fixed his teeth. Without fixing the teeth, you cannot fix the
The
diet.
mother kept thanking you.
Yes.
She was like, oh my god, it's so
Yes.
much better. Even so it helped me help them
Yes,
as well.
and he started eating. So now how did you get him off food and off milk and onto normal food?
So basically we educate the parents, so most importantly, on ways to introduce soft food that is easy to
Yes.
chew and swallow for them. And what happens here is if he's only familiar with the milk, we can mix milk with other foods. And we can have like smoothies, we can have soups, or mashed foods, like sweet potatoes, and he was very after he had his teeth and gums
He was
improved,
hungry.
he was more open to trying different kinds of food.
Because they don't hurt.
Yes, so
they
this
don't hurt.
actually really helped. So for me, what I had to do was to give the mother more education on ways to balance the meals and get nutrition from the meals,
fantastic.
and also to make it
change his
easier, and
psychology.
recipes and so on.
Recipes, and change his psychology to trust food. Because think about it this way: if he had pain from his tooth, does he had pain in his tooth from eating? Does he trust food or not?
Exactly.
It hurts. Why should I trust it? Right? So then, when I cleaned the teeth and I treated the teeth, and then you introduce the familiar with the unfamiliar, it's such a great trick. You know sometimes what I do to get the brush in there, because you know what, 90% of kids here is private. You don't touch me. You don't touch me. So and the brush. I had a boy and he's 14, 1 4.
So he's
now,
a teenager.
خلاص, and he has all his teeth are adult permanent teeth, and he would not touch the brush. He would not touch it. What did I do? What do you think? The familiar with the unfamiliar. I get them to bring the brush, and he likes peanut butter.
No way.
So I put on the brush peanut butter,
so
and I put the butter in, and he liked the peanut butter. And then I kept doing that.
I mean, this is genius.
Oh, thank you.
Wow, but I hope the peanut butter was natural peanut butter.
Right. That's a good one. Okay, which peanut butter next time? We can keep peanut butter here. The thing is, and one more kid, his social reinforcement is popcorn. I put the popcorn here, and he finished everything just to get the popcorn.
Oh, so you did avoid him food?
Unfortunately, what can I do? Look, you have to be resourceful.
Yeah.
The kid likes this, then you have to do something else. One kid a few days ago, he's 14. The mother just thought, she's just gonna bring him, and he's just gonna sit, and he's gonna open, and I'm gonna be able to brush his teeth. And he does not know me. I never brushed his teeth before.
Wow.
Nobody brushed his teeth before.
And he allowed it.
Of course not.
Oh,
He beat me. He beat my staff. He beat the mommy. He's 14. He beat us all. And then I told the mom, "Wallah, so sorry. It's not gonna work. He needs to be socially prepared." We gave him the social story.
Oh,
he
good.
needs to brush at home. He needs the brush with him.
So it's a step by step.
Yeah. So we went through.
You would recommend parents to always come prepared. So if they have to mention. So
Yes.
if you book with Dr. Yasmin or myself, always do mention the case at hand. So my child is on the spectrum, so that you and us are both well prepared for the visit.
Yes.
So it becomes more effective, more efficient,
and it goes smooth and easy.
Exactly.
And honestly, I tried and it didn't work, and I said, "Mom, you know what? I know you want treatment today, but it's not gonna happen." He would not allow the brush next to him. Not even the revolving brush.
They are very strong.
They're very strong. He's a 14-year-old boy. Oh,
yes.
Thank you, Dr. Abdurrahman. Oh, best
Thank
clinic
you.
ever. Thank you, Dr.
Very
Abdurrahman.
fun.
Keep it coming.
So please ask your questions.
Yeah, we love your questions.
We're
you
talking
guys.
today
We love,
about autism.
Kids on the spectrum. We love them.
And what we can do to help
Yes.
in terms of nutrition and dental care. So please feel free to drop your questions in Arabic or in English. Thanks for those who are joining us now. What else? I mean, even you have questions outside the topic scope.
Don't forget to.
But for from nutrition or dental, please also go ahead and ask. We're here to help because we do see also different cases. Do you see cases people with determination as well?
Yeah, a lot. MashaAllah. Yasmin, we see almost 30% of kids either on the spectrum or kids with determination. MashaAllah, the clinic is well equipped to see special needs kids. Okay, for dental management of autism patients, for sure, Doc. Dr. Khaldoon. Yes, hi. How are you, Dr. Khaldoon? How is Bahrain? Was it Bahrain? You're in Bahrain? I think Bahrain.
So what's special also about Dr. Yasmin is that she has specializations in
Yes, I do.
there's hypnotherapy and hypnosis,
and ABA.
and there's the ABA, which work beautifully with the children with the autism and on the spectrum.
They need a special understanding, Yasmin. You need to understand what goes in their mind and how they react and how to get them comfortable and calm. I'll give you an example. We'd have to start wrapping up. But it's good. Now I moved to work in Kuwait. Yay! You work in Kuwait. Let's visit you in Kuwait. I love Kuwait. So I was saying that. What was I saying? I was saying something. Yeah, we have to wrap it up. But I was saying something important about kids.
Yes. So we were talking about your ABA and your hypno and the
I remember. So usually parents want to come in and open the child's mouth because they know he's not gonna open his mouth, and then everybody's on top of him. And what I usually say, look, let him discover his environment. He doesn't know me. Let him get comfortable. And then I let him go here. I'm talking to them, maybe giving him a massage. And like you're saying, free massage. You know why I give massages? Because they feel you better with the sensation, with the physical sensation. So that's a tip for you. Whenever you see a child on the spectrum, give them a massage.
You know what they're scared of?
What?
My white coat.
Yeah, then take it off.
So I actually take it off.
Take it off, girl.
I go down to their level, to the eye level, if they're children, and take off my coat and just talk to them about something else. So because they might think that I will give them like a vaccine or injection.
Of course. They're way too smart for you. They're way too smart. They know what's happening. I love kids when I know مساء العسل همس ورد ايه يا همس احنا لسه هنقفل دلوقتي يا همس وجايه احنا عندنا اسئله كتير ليك يا همس كنت فين؟ Like so now the thing is it is almost time for us to say goodbye. Sorry guys,
it's really a great session always with
it is always with you,
Dr. Yasmin, our very special tooth fairy.
أما عندي سؤال بس حبيت أسأل عنكم وبحبكم أنا أحب شوية همسي. She's so nice, she's so sweet. Thank you, Hamza.
So Ramadan Kareem to everyone watching as well, and
really في العيد. Wow, Eid is coming. We have a vacation.
Here at Festival Lisa Chok, we actually were talking about digestive problems of kids with autism.
Yes.
So with constipation is one of them actually.
Yes.
So constipation is very common, and this is why it's very important to include more fibers, and there's a behavioral approach that is handled also. And really, I think this is a topic on its own. Maybe we can discuss it another time.
We should. Absolutely.
Yes, so thank you for joining us today, and to more IG lives. And if you still have questions, you can always
don't forget to ask.
Drop us a message, a DM. Exactly.
We love you guys. Bye. Enjoy your day. Bye. Where is that?